Hello friends, have you ever suddenly felt your heart racing, difficulty breathing, chest tightness, or that fear you might die all within a minute? That could be more than just stress. It could be a panic attack. And when these attacks repeats, we call it panic disorder. I am Sanntonuu Mandal, clinical psychologist and graphologist, and today's video I will explore panic disorder, what it is, how the brain functions during a panic attack, and the available psychological as well as pharmacological treatment. Panic disorder is an anxiety disorder where a person experiences recurrent unexpected panic attacks. A panic attack is a sudden surge of intense fear or discomfort, reaching a peak within minutes. We can see the symptoms included racing heartbeat, sweating, trembling or shaking, shortness of breath, chest pain, nausea or dizziness, feeling detached from reality. What actually happens inside the brain during a panic attack? Amygdala, the brain's fear center. In panic disorder, the amygdala is overactive, constantly signaling the danger even where there is no real threat. Prefrontal cortex. Normally, the region regulates fear responses. In panic disorder, it fails to calm to amygdala effectively, leading to exaggerated fear. Hippocampus, responsible for memory and context. A faulty hippocampal function means the brain cannot properly distinguish between safe and threatening situations. Neurochemistry. Neurochemistry imbalances in neurotransmitters like serotonin, norepinephrine, and GABA increases the brain's excitability, making panic more likely. In short, panic disorder is not just in the mind. It is a real neurobiological condition where the fear circuitry in the brain becomes hyperactive. So in panic disorder, the risk factors are included like family history and genetics, personality traits prone to anxiety, major life stressors or trauma, chronic stress alerting brain chemistry. First line of treatment is psychotherapy. CBT identifies and reframes catastrophic thoughts. Exposure therapy gradually reduces fear of the situations. Breathing relaxation techniques calms the body during attacks. These therapies retain the brain to regulate the fear response. Doctors may prescribe some medications like SSRIs for first lines, which are fluoxetine, paroxetine, and these all increases the serotonin levels, reduces panic frequencies. SNRIs, these all act on both serotonin and norepinephrine. Benzodiazepines, alprazolam, lorazepam enhances the GABA activity, calming the brain quickly. Tricyclic antidepressants, these are the old drugs, effective but more side effects. These medicines essentially target the neurotransmitter imbalances in the brain's fear circuits, helping the amygdala and prefrontal cortex regain the balance. The good news is, with proper therapy and medication, most patients improve significantly. Supporting habits included regular exercises, avoiding caffeine and alcohol, practicing mindfulness, maintaining sleep hygiene. So, panic disorder is not a weakness. It's treatable brain conditions. If you or someone you know struggling with sudden panic attacks, don't ignore it. Early treatment changes lives. For online consultations, the link is in the description. Stay healthy, stay mindful. Thank you.